Mr. Johnson works at a veterinary clinic that houses a variety of domestic animals, including dogs, cats, and rabbits. Recently, he has observed that many of the dogs, particularly the herding breeds like border collies, have been showing signs of anxiety when left alone. After researching, he learns the herding breeds can exhibit behaviors like chasing moving objects and herding people or other animals due to their natural instincts. What steps should Mr. Johnson take to reduce anxiety and provide appropriate enrichment for these herding breeds? Answer: to address the anxiety and provide appropriate enrichment for herding breeds like border collies, Mr. Johnson should consider the following steps. Environmental enrichment. Herding breeds require physical and mental stimulation to prevent stress and anxiety. Activities like fetch, agility training, and puzzle toys can help fulfill their need for movement and mental engagement. Behavioral enrichment. Since herding breeds are naturally inclined to chase and herd, providing controlled activities like herding balls or training them to fetch specific objects can redirect these instincts into a more positive outlet. Social interaction. Increasing the amount of time spent with the animals, whether through play or structured training sessions, will help alleviate feelings of isolation that may contribute to anxiety. Safe exercise. Ensuring these dogs are exercised in a secure environment like a fenced area or a leash will prevent injuries or escapes while allowing them to expend excess energy. Routine and predictability. Herding breeds thrive on routine, so having a consistent schedule for feeding, playtime, and training will help to reduce their anxiety levels. What are the primary health considerations for larger dog breeds, particularly with regard to their physical structure, and how can caregivers mitigate these risks? Answer: larger dog breeds, such as Great Danes, Saint Bernards, and Mastiffs, are predisposed to several health issues due to their physical structure, including hip dysplasia, a genetic condition where the hip joint doesn't fit into the hip socket properly. This can cause arthritis and pain. To mitigate this risk, caregivers should ensure that large breed dogs are kept at a healthy weight to reduce stress on their joints and exercise them in ways that don't strain their hips, such as swimming. Elbow dysplasia. Similar to hip dysplasia, this condition affects the elbow joint and can lead to pain and lameness. Proper nutrition, weight management, and joint supplements, e.g. glucosamine, that can help prevent or manage this condition. Below, gastric dilatation volvulus. Large, deep-chested dogs are particularly vulnerable to bloat, a life-threatening condition where the stomach fills with gas and twists. Caregivers should avoid feeding these dogs large meals and should ensure they are not exercised immediately after eating. Arthritis and joint issues. Due to their size, larger dogs are prone to developing arthritis as they age. Providing appropriate bedding, regular but not excessive exercise, and joint supplements can alleviate discomfort and improve mobility. Heart disease. Some large breeds are prone to heart issues such as dilated cardiomyopathy. Regular veterinary checkups are essential to detect any early signs of heart disease. These health considerations should be addressed through regular veterinary care, preventive health measures, and tailored exercise plans that support joint and overall health in large dog breeds. Samantha is caring for a rabbit in a small animal shelter. She notices that the rabbit is becoming increasingly withdrawn and is not engaging with its toys or other activities. Upon further observation, Samantha finds that the rabbit is constantly chewing on its cage bars and seems agitated. What steps should Samantha take to improve the rabbit's well-being and prevent boredom and stress in the future? Answer: Samantha should take the following steps to improve the rabbit's well-being and address its stress. Environmental enrichment. Rabbits are highly intelligent and require stimulation to prevent boredom. Samantha should introduce a variety of toys such as wooden chew blocks, tunnels, and treat dispensing puzzles. These items provide both physical and mental stimulation. Safe space for exploration. Rabbits need a space where they can safely hop and explore. Samantha should provide a larger, secure play area where the rabbit can roam freely, ensuring the environment is rabbit-proofed to avoid injury. Social interaction. Rabbits are social creatures and benefit from human interaction. Samantha should spend time petting, talking to, and gently handling the rabbit, which will reduce feelings of isolation. Proper diet. A balanced diet rich in hay, fresh vegetables, and rabbit pellets will keep the rabbit healthy and satisfied, reducing the likelihood of chewing on the cage bars. Cage enrichment. Instead of leaving the rabbit in a barren cage, Samantha could introduce vertical structures, ramps, and platforms that encourage climbing and movement within the cage. How can caregivers customize enrichment activities to meet the specific needs of a species, such as a cat versus a dog, and what factors should be considered when designing these activities? Answer: To effectively customize enrichment activities for different species, caregivers must understand the inherent behavioral and physical differences between species like cats and dogs. Cats are more solitary by nature and need activities that cater to their instinctive hunting behaviors. Enrichment for cats should include hunting games, using laser pointers, feather wands, or puzzle feeders to simulate pre-hunting behaviors, climbing and hiding spaces, providing vertical structures like cat trees, and hiding spots that give cats a sense of security and control, interactive toys, offering toys that encourage exploration and stalking, such as move-in or crinkly toys. Dogs, particularly social breeds, require more interactive and physical forms of enrichment. Activities for dogs should include fetch and agility training, encouraging dogs to run and jump through obstacles to fulfill their need for physical exercise. Puzzle toys, giving dogs interactive toys that dispense treats when manipulated can engage their minds. Social play. Dogs benefit from time with other dogs or humans, which can be encouraged through playdates or training sessions. In both cases, caregivers should consider the animal's age, temperament, and health status when designing enrichment activities. Elderly animals may need gentler activities, while more energetic animals may require more intensive stimulation. What is the significance of recognizing genetic health issues in purebred animals, and how can these issues affect long-term animal care strategies? Answer: recognizing genetic health issues in purebred animals is crucial because many purebred breeds are predisposed to certain inherited conditions. These conditions can significantly affect long-term care strategies, including early detection and prevention. Identifying breed-specific genetic health issues early allows for preventive measures such as regular veterinary checkups, early treatment plans, and genetic screening to manage or mitigate these risks. Tailored nutrition. Some genetic conditions like hip dysplasia and large dog breeds may require specific dietary management to reduce joint stress. A diet rich in joint supplements such as glucosamine may be recommended. Modified exercise plans. Breeds prone to conditions like heart disease may require a carefully controlled exercise plan to prevent exacerbation of symptoms. Conversely, active breeds like Border Collies need high levels of physical and mental stimulation, prolonging quality of life. Being aware of genetic predispositions allows caregivers to take proactive steps to improve the quality of life for these animals, such as managing pain for conditions like arthritis or providing environments that cater to their physical limitations, e.g., orthopedic bedding for dogs with hip dysplasia. Mia works at an animal care center that has just adopted a crossbreed dog. The dog seems to display a mix of behavioral tendencies from both its parent breeds, including the high energy of a Border Collie and the protective nature of a Rottweiler. Mia is uncertain how to best care for the dog, as she knows that mixed breed dogs can inherit a variety of traits from their parents. What strategies should Mia use to address the dog's mixed traits and ensure its well-being in the shelter? Answer: Mia should take the following strategies to address the dog's mixed traits and ensure its well-being. Assessing behavioral traits. Mia should spend time observing the dog to identify its dominant behavioral traits. If the dog exhibits the high energy of a Border Collie, Mia can incorporate activities like agility training or fetch to burn off excessive energy. If the dog shows protective instincts from the Rottweiler side, Mia may need to provide extra socialization with other animals and humans to help reduce overprotectiveness. Providing physical and mental stimulation. The dog should be given both physical exercise like walks or playtime and mental stimulation such as puzzle toys or scent games. The mixed traits of both breeds can contribute to a need for varied activities to prevent boredom and anxiety. Socialization. Mia should ensure that the dog is gradually introduced to new people, animals, and environments. Positive reinforcement training should be used to help the dog respond to its environment in a calm and confident manner. Health considerations. Mia should monitor the dog for any breed-specific health concerns. While Border Collies may be prone to hip dysplasia, Rottweilers may have a higher risk of heart issues, so regular veterinary checkups and appropriate care should be provided. What are the key considerations when designing an exercise plan for a senior dog, and how do these considerations differ from a young dog's plan? Answer: when designing an exercise plan for a senior dog, the following considerations should be made. Joint health. Senior dogs are more likely to suffer from arthritis and joint pain. The exercise plan should focus on low-impact activities such as swimming or slow, controlled walks. High-intensity activities that involve jumping or running on hard surfaces should be avoided. Shorter duration, more frequent sessions. Senior dogs may tire more easily, so shorter exercise sessions with more frequent breaks are preferred. Temperature sensitivity. Older dogs may struggle with temperature regulation. Exercise during cooler parts of the day, such as early morning or evening, will reduce the risk of overheating. Monitoring for signs of fatigue. Caregivers should keep a close watch for signs of fatigue such as limping or excessive panting and adjust the exercise plan accordingly. In contrast, younger dogs generally have higher energy levels and may require more vigorous exercise such as long runs or agility training to meet their physical needs. The exercise plan for younger dogs can be more diverse and intense compared to senior dogs. What are the benefits of providing environmental enrichment for companion animals, and how can it contribute to the animal's overall well-being? Answer: environmental enrichment is crucial for companion animals as it improves their mental, physical, and emotional well-being in several ways. Mental stimulation. Providing toys, puzzle feeders, and training activities helps to stimulate the animal's cognitive abilities, preventing boredom and the development of behavioral problems. Physical exercise. Enrichment activities often involve physical movement, whether it's through play or exploration. Regular exercise is essential for maintaining a healthy weight and overall physical condition. Behavioral improvement. Animals with adequate enrichment are less likely to develop behavioral issues like destructive chewing, excessive barking, or aggression. Enrichment helps to fulfill the animal's natural instincts and reduces the likelihood of unwanted behaviors. Reduced stress. A stimulating environment reduces stress and anxiety in animals by allowing them to engage in natural behaviors such as hunting, climbing, or exploring. This can improve the animal's emotional health. What are the main differences between the care requirements of rabbits and guinea pigs, and how should each be addressed to ensure optimal health and well-being? Answer: while both rabbits and guinea pigs are small mammals, their care requirements differ in several areas. Dietary needs. Rabbits require a high-fiber diet, primarily consisting of hay, like Timothy hay, supplemented with fresh vegetables and rabbit pellets. Guinea pigs also need hay but require more vitamin C in their diet, which can be provided through fresh vegetables like bell peppers or through vitamin C enriched pellets. Space and habitat. Rabbits need a large, secure area for exercise and should be allowed to roam freely in a safe space. They also need access to vertical space, e.g., platforms or ramps, and hiding spots for security. Guinea pigs prefer horizontal space as they are not good climbers. A spacious cage with multiple levels and hiding areas is ideal. Exercise and social interaction. Rabbits need mental and physical stimulation such as hopping, climbing, and exploring, which can be provided through toys, tunnels, and playtime outside their cage. Guinea pigs enjoy social interaction and should be kept in pairs or groups. They require less physical activity but benefit from gentle play and exploration within their designated space. Caregivers must tailor the living environment, diet, and social opportunities for each species to ensure their health and well-being. How do mixed breed animals present unique challenges in terms of care and behavior, and what strategies should caregivers employ to manage these challenges? Answer: mixed breed animals can present challenges due to the variability in their genetic makeup, which may result in a combination of behaviors and health concerns from their parent breeds. These challenges include unpredictable behavioral traits. Mixed breed animals can exhibit behavioral traits from one or both parent breeds, making it harder to predict their needs. For example, a mixed breed dog may display both the guarding tendencies of a Rottweiler and the energy levels of a Border Collie. Health considerations. Mixed breed animals may inherit genetic health issues from either parent breed. Caregivers should ensure regular veterinary care and monitor for conditions that may be more prevalent in one of the parent breeds. Training needs. Since mixed breed animals may combine different behavioral traits, caregivers should adopt a flexible training approach using positive reinforcement and tailoring training methods to the animal's unique temperament. Diet and nutrition. Mixed breeds may inherit dietary preferences or sensitivities from their parent breeds, requiring a customized feeding plan that addresses specific nutritional needs. What factors must be considered when determining the appropriate diet for a senior dog, and how would you adjust feeding practices for this specific animal? Answer: when determining an appropriate diet for a senior dog, several factors must be considered to meet their changing nutritional needs. These include age and size of the dog. As dogs age, their metabolic rate slows down. Larger dogs typically require more protein, while smaller dogs may need a different balance of nutrients. The dog's breed also influences dietary needs due to variations in size, activity level, and health predispositions. Health conditions. Senior dogs are more prone to conditions like arthritis, kidney disease, and obesity. Therefore, a lower calorie diet with joint supplements, glucosamine, may be recommended for dogs with arthritis, while a special kidney support diet with controlled protein levels may be needed for dogs with kidney disease. Activity level. Less active dogs may need fewer calories to avoid obesity, but they should still receive a balanced diet to prevent muscle loss. On the other hand, more active older dogs may require higher energy levels, so the diet should be adjusted accordingly. Nutritional content. Senior dog food should contain easy-to-digest ingredients, a balance of high-quality protein and low-fat content to prevent obesity. Consulting a veterinarian. Veterinary guidance is essential to ensure the diet addresses any specific health concerns and provides appropriate supplements. What are the primary considerations for the vaccination schedule of the puppy, and why is it critical to adhere to these schedules? Answer. Vaccination is vital to protect puppies from potentially life-threatening diseases. The primary considerations include core vaccines. Puppies typically receive vaccines against core diseases such as canine distemper, parvovirus, and rabies, which are universally recommended for all dogs due to their high prevalence and severity. The vaccination schedule often starts at 6-8 weeks of age and continues with boosters of 1-6 weeks, with additional boosters given annually or every 3 years depending on the vaccine and the specific animal. Non-core vaccines, depending on the puppy's lifestyle, e.g. exposure to other animals. Travel vaccines for diseases like bordetella, kennel cough, Lyme disease, and leptospirosis may be administered. These vaccines are typically given after the initial core vaccines. Booster shots. Puppies need booster shots to ensure long-lasting immunity. The timing of boosters is essential because the immunity from mother's milk wanes and the puppy's immune system matures. Missing booster shots may leave the puppy vulnerable to infections. Age and health status. Vaccination schedules should be adapted based on the puppy's age and health status. Puppies with compromised immune systems or underlying conditions may need a modified vaccination schedule. Veterinary supervision. Adhering to the vaccination schedule and consulting with a veterinarian ensures that the puppy's immune system develops appropriately and that the risk of preventable diseases is minimized. Mr. Harris, a pet owner, has noticed that his 10-year-old cat is lethargic, has lost weight, and is drinking excessive amounts of water. What steps should Mr. Harris take, and what potential underlying health issues could be causing these symptoms? Answer. Mr. Harris should take the following steps. Immediate veterinary visit. Given the symptoms of lethargy, weight loss, and excessive water consumption, the first step is to take the cat to a veterinarian as soon as possible. These symptoms could indicate a serious health issue such as kidney disease, diabetes, or hypothyroidism. Veterinary assessment. The veterinarian will conduct a thorough examination including blood tests and urine analysis to check for common conditions in older cats such as chronic kidney disease, CKD. Cats with CKD often show signs of lethargy, weight loss, and increased thirst and urination. Diabetes mellitus. This condition can cause excessive drinking, weight loss, and lethargy, often seen in older cats. Hypothyroidism. Overproduction of thyroid hormone in older cats can lead to symptoms like weight loss despite increased appetite, excessive thirst, and lethargy. Treatment plan. Depending on the diagnosis, the treatment plan may include medication, dietary changes, insulin injections in the case of diabetes, or fluid therapy for kidney disease. Monitoring and follow-up. Mr. Harris should closely monitor the cat's symptoms and follow the veterinarian's advice on treatment and follow-up visits to ensure that the condition is managed appropriately. What are the key elements that should be included in an incident report when an animal escapes from its enclosure at a veterinary clinic, and why is detailed documentation crucial? Answer. When documenting an incident such as an animal escape, the key elements to include are incident description, a clear and concise account of what occurred, including the time, location, and nature of the escape. For example, at approximately 10:30 a.m., a dog named Max escaped from the holding area after the gate was accidentally left ajar. Circumstances leading to the incident, detailing any factors that contributed to the escape, such as human error, equipment failure, or environmental factors, e.g. a loose latch or inadequate fencing. Actions taken. A description of the immediate actions taken after the escape, such as attempts to retrieve the animal, notifying staff, and securing the premises. Animal status. Record the condition of the animal following the escape, e.g. whether it was safely retrieved, any injuries sustained, or whether the animal was involved in any accidents. Preventive measures. Identifying steps taken to prevent future escapes, such as improving security, training staff, or upgrading equipment. Staff involved. Names of the staff involved in the incident, including those who may have contributed to the escape or assisted in its resolution. Detailed documentation is essential for the following reasons. It provides a clear record for future reference and accountability. It assists in identifying patterns or weaknesses in procedures that need to be addressed to prevent future incidents. It serves as evidence in case of any legal or regulatory review, ensuring compliance with safety standards and regulations. How would you handle a situation where you notice a puppy showing signs of parvovirus, and what are the recommended actions to ensure proper management of the disease? Answer: in the case of a puppy showing signs of parvovirus, which may include vomiting, diarrhea, lethargy, and loss of appetite, the following steps should be taken. Immediate veterinary care. Parvovirus is a highly contagious and potentially deadly disease, so immediate veterinary care is essential. Diagnosis. The veterinarian will confirm the diagnosis with a fecal test or PCR polymerase chain reaction test to detect the virus. Early intervention increases the likelihood of survival. Isolation. Parvovirus is highly contagious, so the infected puppy must be isolated from other animals, especially unvaccinated dogs, to prevent the spread of the disease. Treatment. Treatment for parvovirus is supportive, as there is no specific antiviral cure. The focus will be on preventing dehydration, maintaining electrolyte balance, and managing symptoms like nausea and vomiting. Vaccination and prevention. Vaccination is the best preventive measure. Puppies should receive their vaccinations at the appropriate times to ensure immunity before exposure to the virus. Owner education. Informing the pet owner about the importance of timely vaccination and avoiding contact with potentially infected animals is critical to preventing future outbreaks. Explain the impact of overfeeding a pet cat and the potential long-term health risks associated with an imbalanced diet. How can these risks be mitigated through proper feeding practices? Answer: overfeeding a pet cat can lead to several health problems such as obesity, diabetes, and joint stress. The long-term risks associated with overfeeding include obesity. Overfeeding leads to excessive weight gain, which can strain the cat's joints and increase the risk of arthritis. Obesity also leads to a decreased lifespan and overall quality of life. Diabetes. Obesity is a major risk factor for the development of diabetes in cats. The excess fat interferes with the body's ability to regulate blood sugar, leading to insulin resistance. Heart disease. Excess weight can increase the risk of heart disease by placing additional strain on the heart and blood vessels. Joint issues. Extra weight places pressure on the joints, leading to arthritis or exacerbating existing joint conditions, causing pain and reduced mobility. Digestive problems. Overfeeding, especially with low-quality food, can lead to gastrointestinal issues such as constipation or diarrhea. Mitigation strategies. Proper portion control. Feeding the cat a balanced amount of high-quality food tailored to its specific age, breed, and activity level helps prevent obesity. Regular monitoring. Weighing the cat regularly and adjusting its diet based on its health status helps maintain an ideal body condition. Veterinary guidance. Consulting a veterinarian ensures that the diet is nutritionally balanced, considering the cat's health conditions and lifestyle. Why is it important to keep detailed records of a pet's behavior changes, and how can this data be used in treatment planning? Answer: keeping detailed records of a pet's behavior changes is essential for several reasons. Early detection of health issues. Behavior changes such as lethargy, aggression, or changes in appetite may be early signs of underlying health issues. By tracking these changes, pet owners and caregivers can detect problems early, leading to more effective treatment. Tracking treatment effectiveness. Monitoring behavior can help determine whether a treatment plan is working. For instance, if a cat's aggression diminishes after starting a medication, it suggests that the treatment is effective. Identifying trends. Over time, tracking changes in behavior can help identify trends such as seasonal behavioral shifts or reactions to particular stimuli, aiding in better care planning. Personalized care. The data gathered can be used to customize the pet's care plan, ensuring that treatments, medications, or dietary changes are suited to the individual pet's needs. Compliance with legal and ethical standards. Accurate records are important for compliance with animal care regulations and legal requirements, providing an official record of treatment decisions and outcomes. What sanitation practices should be followed in a veterinary clinic to prevent the spread of infectious diseases among animals? Answer: sanitation practices in a veterinary clinic are crucial to prevent the spread of infectious diseases. Key practices include regular disinfection. High-touch surfaces, kennels, and equipment should be disinfected regularly using veterinary-grade disinfectants that are effective against a wide range of pathogens, including viruses, bacteria, and fungi. Hand hygiene. Veterinarians and staff should wash hands thoroughly between handling animals and using hand sanitizers if soap and water are unavailable. Proper waste disposal. Feces, urine, and contaminated bedding should be disposed of promptly to avoid contamination of other areas. Isolation areas. Animals with suspected infectious diseases should be isolated from healthy animals, and protective barriers should be in place to prevent cross-contamination. Personal protective equipment (PPE). Veterinarians and staff should wear appropriate PPE, such as gloves, masks, and gowns, when treating infected animals to reduce the risk of transmission. Cleaning protocols. Implementing specific cleaning protocols for different types of animals and their environments is essential to ensure the thorough removal of pathogens. How does a high-protein diet affect the health of a growing puppy, and what precautions should be taken when selecting a diet for large breed puppies? Answer: a high-protein diet supports growth in puppies, providing essential amino acids for muscle development, immune function, and overall health. However, excessive protein intake can lead to certain health issues, particularly in large breed puppies, excessive growth and joint stress. In large breed puppies, a high-protein diet may lead to rapid growth, which could strain developing joints, increasing the risk of orthopedic issues like hip dysplasia and osteochondritis dissecans or CD. Imbalanced nutrients. Large breed puppies have unique nutritional needs, including controlled levels of calcium and phosphorus to promote proper bone development. A high-protein diet that lacks the correct calcium to phosphorus ratio can lead to bone deformities and growth abnormalities. Precautions. Formulated puppy foods. It is crucial to select puppy food specifically formulated for large breed dogs, which provides the right balance of protein, fats, carbohydrates, and minerals. Veterinary advice. Consulting with a veterinarian ensures the puppy's diet supports healthy growth while minimizing the risk of developmental issues. What steps should be followed when recording treatment and vaccination history for an animal, and why is this record keeping essential for veterinary care? Answer: accurate recording of treatment and vaccination history is crucial for tracking medical history. Each animal's treatment history, including vaccinations, medications, surgeries, and any adverse reactions, should be recorded. This provides an ongoing, comprehensive medical profile that is essential for future care, ensuring compliance with vaccination protocols. Keeping track of vaccination schedules ensures that animals receive timely boosters and are protected from preventable diseases. Treatment effectiveness monitoring. Documenting each treatment, its dosage, and the outcomes allows veterinary professionals to assess whether the prescribed treatment is effective or needs adjustment. Legal and ethical compliance. Record keeping ensures that veterinary practices comply with regulatory requirements for animal care and legal documentation standards. Steps for recording. Date and time of treatment, vaccination. Record the date, time, and name of the animal receiving treatment or vaccination. Details of treatment include the type of medication, dosage, and route of administration. Veterinary notes. Add any observations about the animal's response to treatment, including side effects or complications. Follow-up plans. Note any required follow-up treatments or additional doses. Proper documentation is critical for ensuring the continuity and quality of care, as well as for legal and regulatory purposes. What are the key steps in assessing the severity of an animal's injuries or illness, and how should a first responder prioritize actions in an emergency situation? Answer: when assessing an animal's injuries or illness, the key steps are initial assessment. Quickly check the animal's overall condition by observing behavior, vital signs, heart rate, respiration rate, and temperature, and any visible injuries. Airway, breathing, circulation, ABC. Prioritize ensuring the animal's airway is clear. Assess breathing rate and effort, and check circulation, e.g., pulse, capillary refill time. If any of these are compromised, take immediate corrective actions. Physical examination. Conduct a focused examination for specific injuries, e.g., wounds, fractures, or symptoms, e.g., vomiting, lethargy. Assessing pain levels. Use appropriate handling to determine if the animal is in pain or distress, as this will guide the urgency of care. Determine the need for immediate veterinary care. Identify critical situations like severe bleeding, difficulty breathing, or unresponsiveness that require professional intervention. Relevant guidelines and laws. Australian Animal Welfare Standards and Guidelines for the Care and Use of Animals in Veterinary Practices, Veterinary Surgeons Act. Describe the basic first aid procedure for managing a wound on an animal, particularly focusing on cleaning, dressing, and preventing infection. Answer: for wound management in animals, safety first. Ensure the safety of both the animal and the handler. If the animal is agitated or aggressive, use appropriate restraint techniques to prevent injury. Control bleeding. Apply gentle pressure with a clean cloth or bandage to stop any bleeding. If the wound is severe, elevate the area if possible to reduce blood flow. Clean the wound. Gently clean the wound using sterile saline solution or clean water. Avoid using antiseptics like hydrogen peroxide or alcohol, as they can damage healthy tissue. Apply an antibiotic ointment if instructed by A veterinarian apply a thin layer of antibiotic ointment to prevent infection, dressing the wound. Cover the wound with a sterile dressing to keep dirt and bacteria out. Use a bandage that is snug but not too tight to allow blood flow. Monitor for infection. After the first aid is applied, monitor for signs of infection, including swelling, redness, or discharge. Seek veterinary care if these symptoms arise. Relevant guidelines and laws. Australian Animal Welfare Standards, the Veterinary Surgeons Act. Mr. Taylor is at a park with his dog, and the dog starts to show signs of distress, including labored breathing and drooling. Mr. Taylor is unsure if the dog is overheating or if there is another underlying issue. What should Mr. Taylor do in this situation? Answer: in this scenario, Mr. Taylor should follow these steps. Assess the environment. Check if the dog has been overexerting itself in hot weather or if it is in a stressful situation. The signs of distress, labored breathing, and drooling suggest a possible heat stroke, but could also indicate other medical issues like poisoning or an allergic reaction. Move the dog to a cooler environment. If heat stroke is suspected, move the dog to a shaded or air-conditioned area immediately. Begin cooling the dog by spraying or soaking it with cool, not cold water and allowing it to drink small amounts of water. Monitor vital signs. Check the dog's heart rate and respiration. If breathing is excessively labored or if the dog's condition worsens, Mr. Taylor should seek immediate veterinary care. Veterinary care. If the dog does not show improvement or becomes unresponsive, Mr. Taylor should take the dog to a veterinarian without delay. Relevant guidelines and laws. Animal Welfare Transport Standards, the Veterinary Surgeons Act. What are the primary differences in anatomy between a dog and a cat that might affect their care, particularly regarding their respiratory systems and how they are affected by stress? Answer: key differences between dogs and cats in terms of their respiratory systems include respiratory rate. Cats typically have a higher respiratory rate than dogs. The normal rate for cats is around 20-30 breaths per minute, while dogs generally range from 10-20 breaths per minute. This difference is important when assessing stress, as rapid breathing in either species can indicate distress. Lung structure and function. Cats have more efficient lungs and higher lung capacity relative to their body size, which helps in maintaining oxygen levels during periods of stress or exertion. In contrast, dogs, especially brachycephalic breeds like bulldogs, can suffer from airway obstructions or difficulty breathing when stressed. Stress responses. Cats are more sensitive to stress and can experience sudden respiratory distress if subjected to anxiety, while dogs may show more overt signs like panting or drooling. Cats may hide their distress, making it harder to detect early symptoms of respiratory issues. Relevant guidelines and laws. Australian Animal Welfare Standards, the Veterinary Surgeons Act. Explain the importance of recognizing abnormal physical conditions in animals and provide examples of common abnormalities that require immediate attention. Answer: recognizing abnormal physical conditions is essential for ensuring the health and well-being of animals. Common abnormalities that should prompt immediate attention include swelling or puffiness. Sudden swelling, particularly in the face or limbs, can indicate an allergic reaction, infection, or trauma. Unusual discharge. Presence of abnormal discharge from the eyes, nose, mouth, or ears can signal infections, foreign bodies, or serious systemic conditions. Limping or difficulty moving. Any sudden change in movement, such as limping, reluctance to walk, or difficulty standing, can indicate fractures, joint injuries, or neurological issues. Excessive panting or labored breathing. This may be a sign of heat stroke, respiratory distress, or heart problems, especially in brachycephalic breeds. Changes in appetite or behavior. A sudden loss of appetite or changes in behavior. Lethargy, aggression may indicate systemic illness or pain. Relevant guidelines and laws. Australian Animal Welfare Standards, the Veterinary Surgeons Act. What are the recommended grooming techniques for handling a long-haired dog, and how do these techniques differ from grooming a short-haired dog? Answer: grooming long-haired dogs requires special care to prevent matting and skin irritation. Brushing. Long-haired dogs need to be brushed regularly to remove tangles and prevent mats. Use a comb or slicker brush, starting at the ends and working towards the roots. Bathing. Use a mild dog shampoo and rinse thoroughly to prevent skin irritation. Long-haired dogs may require more frequent baths, especially if they get dirty or have skin conditions. Trimming. Trim hair around the paws, ears, and under the belly to keep it tidy and reduce the risk of mats. For short-haired dogs, brushing. Short-haired dogs require less frequent brushing, but a rubber brush or grooming that can help remove loose hair and reduce shedding. Bathing. Bathing should be less frequent than with long-haired dogs, as their coats do not accumulate dirt and oils as quickly. How can a pet owner identify if their dog is in shock, and what immediate actions should be taken? Answer: signs of shock in dogs include Pale or blue gums. Reduced blood flow can cause the gums to appear pale or bluish in color. Rapid breathing. Dogs in shock may exhibit rapid, shallow breaths as their body tries to compensate for lack of oxygen. Weak pulse or low blood pressure. A dog in shock may have a weak pulse or low blood pressure, which is difficult to detect without specialized equipment. Lethargy or unresponsiveness. Dogs in shock may become weak, disoriented, or unresponsive. Immediate actions include calming the dog, keep the dog calm and warm. Stress can worsen shock, elevating the hind legs. If possible, elevate the dog's hind legs to improve blood flow to vital organs. Seek veterinary care immediately. Shock is a life-threatening condition and requires professional medical intervention. What is the role of a veterinary nurse when administering medication to an animal, and what precautions should be taken to ensure the safety of both the animal and the handler? Answer: the role of a veterinary nurse includes administering prescribed medications. This includes giving oral medications, injections, and topical treatments as directed by the veterinarian, monitoring for adverse reactions. Veterinary nurses should monitor the animal for signs of side effects or allergic reactions to the medication, ensuring accurate dosage. The nurse should confirm the correct dosage, method of administration, and timing before giving any medication. Providing education to owners. Nurses should educate pet owners on how to administer medication at home, including any precautions to take. Precautions include handling medications safely, wear gloves when handling potentially harmful medications, e.g. chemotherapy drugs, or when administering injections. Proper storage. Medications should be stored according to the manufacturer's guidelines, such as refrigeration or protection from light. Monitoring the animal. After administering medication, observe the animal closely for any adverse effects. What are the essential aspects of skin care during the grooming process, particularly for animals prone to skin issues or allergies? Answer: for animals prone to skin issues or allergies, choosing the right products. Use hypoallergenic shampoos and conditioners specifically designed for sensitive skin to avoid irritation. Avoid overbathing. Bathing too often can strip the skin of natural oils, leading to dryness or irritation. Only bathe when necessary. Inspecting the skin. Check for signs of fleas, ticks, or rashes during grooming. If any issues are found, consult a veterinarian for appropriate treatment. Moisturizing. Some animals with dry skin may benefit from a gentle moisturizing treatment to restore hydration to the skin. Relevant guidelines and laws. Australian animal welfare standards emphasize the importance of proper skin care, particularly for animals with known sensitivities. The Veterinary Surgeons Act provides guidance on safe skin treatments and managing allergies in animals. Why is it critical to clean and disinfect grooming tools between uses, and what are the potential risks of failing to do so? Answer: cleaning and disinfecting grooming tools is critical to prevent cross-contamination. Bacteria, fungi, and parasites can be transferred from one animal to another through contaminated tools. Avoid skin infections. Unclean tools can introduce pathogens into wounds or cuts on the animal's skin. Preserve tool longevity. Regular cleaning helps maintain the condition and effectiveness of grooming tools. The risks of not disinfecting include spread of infectious diseases. Tools can transmit ringworm, fleas, or skin infections. Injury or discomfort to animals. Damaged or unclean tools can cause scratches or irritation. Relevant guidelines and laws. Australian animal welfare standards mandate the hygiene and safety of tools used in animal care to prevent disease transmission. The Veterinary Surgeons Act emphasizes the importance of maintaining a clean environment and tools to protect animal health.